Psychological stabilization of diabetics. Understanding the psychology of people with diabetes can help loved ones better support the patient. Therefore, to reduce stress or negative thoughts, try the following tips for yourself and your family. 1. For sick people. Take care of yourself but don't aim for totality. The reality is that it is very difficult to control diabetes perfectly. In the first few days, you can be overwhelmed by many instructions to follow, such as checking your blood sugar regularly, choosing foods for meals, how much food is allowed to eat, remembering when to take your medicine, or choose what are the best decisions for your health. Instead of panicking and trying to adapt to these dozens of changes prematurely, you can learn to adapt and change little by little. Even if your condition has only improved slightly, don't hesitate to give yourself some words of encouragement. Chat. Be more open about your own health. The common psychology of people with diabetes is that they are often afraid that talking about their condition will make family members feel upset. Did you know that only when you speak out, people can understand and solve problems with you? Moreover, this will also help you feel lighter, like a weight has been lifted from your heart. If you have a hard time, you should find the person you feel closest to. It's best to be upfront about the problems you're having and mention specific things people can do to make you more comfortable. Don't hesitate to ask for help. You will be surprised to know that the people around you can support you in many different ways. For example, they can remind you to take your medications on time, help you measure your blood sugar, assist you in your physical activity, or even prepare delicious, nutritious meals to suit your needs. Doctor's request. If you are lucky enough to have a family member or friend who works in the medical field, they will help you learn more about diabetes guidelines or suggest what to talk with. Doctor during health checkups. Please discuss further with your doctor or relevant professionals. Don't be afraid to talk to your doctor about the difficulties you're having. They can give you helpful advice on how you can improve the problem. If you can't afford it, your doctor can refer you to a psychologist. If you are worried about the cost of medical treatment, you can also ask for information from your doctor or medical staff in the hospital about the support programs of organizations or governments for people with diabetes. Street. Chat with like-minded people. This is also an effective measure to help stabilize the psychology of people with diabetes. Because people with the same health problems as you may have more experience managing the disease. What's more, they can help you feel less isolated in your own situation. Eat well and rest properly. When the psychology falls into confusion, anxiety, people with diabetes often fall into a state of indiscriminate eating. This is completely detrimental to health. The best key to getting back on track is to rest and eat as nutritiously as possible. You should remember that having diabetes does not make us disabled. You can still work, create and contribute. Therefore, you should not miss anything but live every moment to the fullest. 2. For relatives, assist patients in taking medication and checking blood sugar. If your loved one is elderly and forgetful, assist them in taking their medications to make sure they get the right dose and on time. This helps them keep their blood sugar in a stable range. Besides, you can teach your loved ones how to use a blood glucose meter to check their own blood sugar or help them do this and make a chart for them to follow easily. Physical activity. Regular physical activity not only helps lower blood sugar, blood pressure and cholesterol, but also improves the flexibility of the joints, helps the heart, strong bones, toned muscles and maintains a healthy weight. Physical activity can also help reduce stress, which helps improve psychological well-being for people with diabetes. Therefore, do not hesitate to support your loved one in this matter. If you have time, you should exercise with them. This is not only good for health but also helps family members bond more. Supporting patients with nutritional issues. To achieve the goals in controlling the glycemic index, the complications of the disease, people with diabetes need to follow a strict diet. Therefore, you should support the patient in choosing healthy foods, aligning food intake and eating times of the day. Empathize with the patient's condition. Diabetes is a progressive disease over time, so patients often experience negative psychological effects. Therefore, family members should take care of the sick person, often talk to and help the sick person when they need it. These activities not only help relieve the patient's psychological stress, but also can partially support the treatment process.